This week on Empowering Midlife Wellness, I'm talking about 5 things in women's health and medicine in general that we just got completely wrong. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated to taking care of women in midlife and beyond so we can feel great now and also feel great with each decade that comes. And that project really starts now. Well, this week I was really thinking about a list of things that I was taught that were wrong, that we have subsequently learned were wrong, and how important it is for doctors to keep learning and to be able to say, hey, you know what, I was wrong about that. And I'll just say that I think it's true that the medical profession probably attracts a greater than average percentage of personality types that really enjoy being right. I must say I like being right, but people who just want to hang on to old ideas and are just not willing to let them go. And I'm going to talk about 5 of my biggest topics that we got completely wrong. And I'll just say I got completely wrong because this is what I was taught and I passed it on. I regret that I did that, but it was the best that we knew at the time. And I take responsibility for continuing to learn so that I can say, hey, you know what I told you last year? We've learned something new this year, and I recommend changing what I said before. And if your doctor's not doing that, I think that's a sad situation because science is evolving. And if we can't say I was wrong, that means we can't ever learn. And goodness knows we only know a fraction that there is to know about medicine, and that learning is accelerating almost quicker than we can keep up with. But I could probably name 30 things I got wrong, but let me just name my top 5. Well, you're not going to be surprised that number 1, the biggest one by far, is what we got wrong about menopausal hormone therapy. Now, I could just leave it at that because there's so many videos that I've made about that topic, but very briefly, 2002, we were scared that estrogen caused breast cancer, heart disease, stroke. Everybody stopped taking it. We were so wrong about that, and now we know we're evolving out of that misunderstanding to know that menopausal hormone therapy is not only safe for almost everybody, but beneficial and actually improves our lifespan, reduces our risk of dying from breast cancer, from colon cancer, from neurologic decline, from osteoporosis-related injuries, and most importantly, from heart disease. So we got that completely wrong. And if you're still seeing a provider, or if you in your own mind are still having trouble letting that idea go, totally understand. When we're taught something for 20 years, it's really hard to let go of it. It's something that we believe deep in our soul. Estrogen causes breast cancer. So yeah, it's hard to let go of, but just let it in a little bit at a time. And there's so much good information out there that will support you in your decision to accept a new belief, because we were wrong about that. Now, number 2, I'm going to say we were wrong about everything to do with metabolic function. I'll just lump it all together. Here's what I was taught. There were 2 types of people: diabetics and non-diabetics. That was it. There was a number that you had to cross. After that, you were diabetic, but before that, we didn't worry about you and everything was fine. Well, if you think about that for 5 minutes, it doesn't make any sense. Metabolic disease is on a continuum. So we can have a little of it gets a little worse, and so on, and somebody made a cutoff at which time we're called diabetic, but we don't want to really be anywhere on that continuum. And by metabolic dysfunction, I mean any dysfunction in the optimal metabolism of what we're eating. So we're metabolizing our food, our macronutrients, protein, carbohydrates, fat, we're storing it for later use. That whole process needs to be optimal, and when it breaks down, way before we get to be diabetic, process called insulin resistance, which is very commonly talked about. I've made several videos about it. We talked about it last week in the context of using a glucose monitor to keep your blood glucose very stable throughout the day. But as we get less sensitive to this critical hormone insulin, all kinds of bad things happen way before we get a diagnosis of diabetes, or we may never get a diagnosis of diabetes. So just as a brief review, we become insulin resistant as a function of losing our hormones. So menopause is an independent risk factor for insulin resistance. We do become more resistant to insulin. So we have less optimal control of our glucose, more spikes in glucose at a time when we're often eating a little bit more and being less active. So it's a critical time for us to look at our metabolic function really with a magnifying glass and make sure that it's optimal. We don't want you to be normal or average. We really want you to be optimal, because even as it starts to change a little bit, we see fat around the middle, which nobody likes. But more importantly, as that happens, it increases our risk of serious diseases. Of course, diabetes, but also liver disease, heart disease, brain disorders, cancers, so many things. So we just got that completely wrong. So if your doctor is still telling you things like, well, your fasting glucose is a little higher than last year, but just come back when it's worse, or your hemoglobin A1C, it went up a bit, but don't worry, you're still just in the pre-diabetic range, so we'll watch it. These are terms that I used to use. I used to tell patients, well, just come back next year, we'll watch it. Well, guess what we were watching it do? We were watching it go up. So if you're still hearing that language, advocate for yourself. There's lots of providers out there, and you can have a discussion with your provider and say, hey, I wanted to talk about whether I might have insulin resistance. And if you don't get the answer that you want to, you probably know more than they do, because this is what we were taught. So everything to do with metabolic function needs to be optimal. The reason why is that this is not an overstatement. If we could all have optimal metabolic function, that means having blood glucose that is normal fasting, our insulin is low, goes up to 120, maybe 140 at the highest. The risk of chronic disease, all the big ones, heart disease, obviously diabetes, neurologic disease, and cancer would drop dramatically. It's a no-brainer. So let's hone in on that one with a magnifying glass and not just look at it from such a high-level space. Okay, number 3, what we got wrong was everything we told women in particular about exercise. So if you're anything like my age, I grew up with Jane Fonda and aerobics and stepping up and down off a step, and we all wanted to be skinny, and we all wanted to do tons of cardio and just run like crazy, and nobody was lifting weights because we were afraid we'd get bulky, or afraid we'd get injured, or we were told that it would cause us to break a bone, or all kinds of other nonsense, especially for women our age, almost suggesting, without ever being said, I don't think, that there's a certain age after which that you shouldn't really do much. I think this is what my mom's generation were told. When you get to be 50 or so, you should just go fishing or play bridge or just sit around. Just don't do much because you're kind of fragile and we don't want you to get hurt. We were so wrong about that. So we do not want to be sitting around and worrying about getting hurt. We want to be out there being as active as we can. Now, we do not want to get injured, obviously, and we want to do something that we can be consistent with and something that we like. So in the field of exercise, consistency, don't get injured, and like it. That's the important things. And we want to make it varied. So this recommendation is still present from the U.S. government that people should do 150 minutes a week of brisk walking or something similar is way too little. So that obviously equates to 30 minutes 5 times a week of walking. Well, that might be enough for your dog if your dog is really old. It's not nearly enough for a human being. So yes, by all means walk. Walking's great. I love to go walking with a friend. It's a great way to see nature, to enjoy the outside, but it's not exercise. Walking should be what you do just to get around in your normal life. Exercise is something more than that, and it's really okay to push ourselves. Now, again, see a physician, make sure that you're healthy enough to exercise and don't get injured, get a trainer or someone to help you. But within those very broad boundaries, you can do hard stuff. We want you to do hard stuff. Lift heavy weights, heavy enough to really use your muscles without getting injured. Jump up and down. We want to pound on your bones and muscles. We want to keep your body active. There's a common idea I still hear. I'll have patients come in who have some bone loss. Maybe they've been diagnosed with osteopenia or even osteoporosis, and they were told you should stop exercising because you might break a bone. Completely wrong. What we really want to do is do a lot of strength training, a lot of exercise if we have osteoporosis. Not just do little old lady pull aerobic classes that have no impact at all on your bones or very little on your muscles. That would be something that I would recommend doing if you're 95 and there's nothing else you can do. But for those of us who are in our 50s, 60s, 70s, we want to be polarizing our exercise. That means doing a lot of different things. Yeah, do some walking, do some heavy weightlifting, do some pounding or jumping if you can. Do something hard, get your heart rate up really high, do some sprints up and down or walking on a very steep grade, something that really gets your heart rate up to 80 to 90% of its maximum. We don't have to be worried that we're too fragile to exercise, and this 150 minutes a week idea is not even close to enough. We need to resistance train. Now, most of us know this now because it's so prevalently spoken about, but as we get older, we lose muscle mass very quickly, up to 10% per decade. So as we lose muscle, if we're not doing resistance training, it increases our risk not only of obvious things like falling down and breaking a bone, that makes sense, but also affects our metabolism because muscle's so intricately involved in keeping our blood sugar stable. So it increases our risk of diabetes, which increases the risk of heart disease and brain disease, and everything goes wrong when we lose muscle mass. So by all means, go for a walk. Take your doggy for a walk, but that is not exercise. We need to do more than that. We got that completely wrong. Is there too much exercise? Probably not. I have tried, and yeah, certainly we can overtrain. We're talking about people who are, running a marathon every month or a couple of Ironman races a year. But for the most average person, doing an hour or two of exercise a day is perfectly fine. So go for it. Do as much as you can, and way more than 30 minutes 5 times a week. All right, so moving on to the next one. The fourth thing I got totally wrong was that antibiotics are basically safe. And I can't tell you the number of Z-Pak prescriptions that I wrote. Stopped doing that about 5 years ago. But in my medical career for 20 years, if I had a cold or my patient had a runny nose, maybe they just called over the phone and I haven't even examined them, I would prescribe them something like a Z-Pak. And we would say that, well, if you have a virus, it's not going to help, but it won't hurt you. So you might as well take it anyway. And guess what? Almost everybody got better in 4 days, and so they thought the Z-Pak was amazing. But 95% of upper respiratory infections are caused by a virus. And so most of you know, viruses are not killed by antibiotics. So they did absolutely nothing at all to make you better. But what they did do is they completely obliterated our very healthy gut microbiome, assuming it was healthy. So it completely changes the gut microbiome. And we talk a lot about that because we know now that the gut microbiome, the bacteria that live in our gut and on our body also, are vital to our health. So when we take antibiotics, we're destroying that. Now we can get it back if we're lucky, but many people who are on recurrent courses of antibiotics never get it back. It increases the risk of so many diseases, but one of the most interesting ones is obesity, and guess what? Diabetes, because our gut microbiome is intricately involved in metabolic function. So taking antibiotics when you don't need them, we got terribly wrong. I got terribly wrong. Antibiotics are amazing, absolutely life-saving. They've changed the course of medicine for sure, but please don't take them when you don't need them. And I think with the acceleration in telemedicine, where people are being prescribed things and not being seen, I mean, that's really ramped this up. I would be very cautious about taking an antibiotic. Absolutely take it if you have a bacterial infection that warrants taking something. But taking it for a cold, please stop doing that. It's going to make you way sicker than any cold could ever make you. So we got that wrong. I got it wrong. So my number 5 about stuff we got wrong, pretty much everything to do with cholesterol. So boy, did we get that wrong. So here's what I was taught, probably what you were taught too, if we're around the same age. Number 1, this was 20 years ago, but it hangs around in our brains. Number 1, we were taught HDL, high density lipoprotein, is good, right? Higher the better. We were taught LDL, low density lipoprotein, is bad. But we were taught if your HDL is high enough, like if it's really high, so for example, if it's say over 60, which is a nice high number, it would kind of negate any elevation in your LDL. So I told patients that for years. This is what I was taught. Maybe they had an LDL that was elevated. Maybe it was something like 140. And I tell them, well, your HDL is 80, so it doesn't matter. It's fine. Completely wrong. So we know now, I've spoken about this before, that is not the case at all. In fact, drugs were developed to increase HDL because it sounded like such a great idea. Let's make HDL super high. Didn't work. And so it's really kind of a tough pill to swallow to realize that low HDL is not good for sure. That can indicate that there's an increased risk for heart disease, but high HDL is not protective. Once it's beyond a certain level, having more is not helpful. In fact, it can indicate that there's a problem with its function. HDL is really complicated, but when we measure it in a blood test, we're not able to tell anything about its function. We're just measuring a number. So it doesn't translate to higher is better. It also doesn't translate to we can just forget about your LDL being high. Having high LDL is important, and even more important, all of you know now that LDL is just a measurement of one of the atherogenic particles. There are lots of them. And so what we recommend measuring now is a protein called ApoB. So apolipoprotein B is a protein on the outside of all of the atherogenic particles, not just LDL, but also all of its cousins with a bunch of alphabet soup, VLDL, IDL, LP(a). So ApoB is a much better measurement, and we do want to take that seriously. Now in menopause, our cholesterol goes up. It's one of the things that changes with hormone depletion. So in almost every woman, we're going to see your LDL, your ApoB are going to start going up in menopause. Now, if you take menopausal hormone therapy, we might see that come back down again. But during the time that you're hormone depleted, not only is your blood sugar going up, but so is your lipid panel. And that's why we see an increase in diabetes and heart disease in women who are not treated post-menopause. So let's take that seriously. And there are other elements of the lipid panel that I was taught to completely ignore. I wasn't taught to look at triglycerides, which are incredibly important. We really want our triglycerides to be less than 100. Those go up as HDL goes down. So there's a complex little dance that's happening in our liver. And guess what drives most of it? Is insulin resistance. In the same topic of what we got wrong about cholesterol, I was taught that eating cholesterol in the form of animal products is what elevates cholesterol. So remember, we were taught that we shouldn't eat saturated fat. Those are the fats that are mostly in animal products. So saturated fats cause heart disease. This is what we were taught. So we should go on a low-fat diet, eliminating animal products, and that'll reduce our risk of heart disease and lower our cholesterol. Guess what? It did that in rabbits, but in humans, we do not absorb much at all of the cholesterol that we eat. Now, cholesterol is an animal product. It's part of an animal cell wall, so it's only found in animal products like meat, fish, chicken, eggs, and dairy. Remember, we used to say don't eat egg yolks. We were wrong about that. So all of these ideas to reduce saturated fat were based on the idea that if we ate cholesterol, it would elevate our cholesterol. Well, it doesn't. We were wrong. I was wrong. I talked about that for years. I told people to lower animal fats and that would help their cholesterol. The great majority, almost all of the cholesterol that we pick up when we draw your blood is made in your own liver. It's got nothing to do with what you're eating other than the thing that elevates it is eating too much sugar, particularly highly processed food. So it's so interesting, and it would be comical if it hadn't led to so many patients getting really sick, that everything seems to be coming back to getting rid of processed food, getting rid of insulin resistance by eliminating glucose spikes. That's what we want to do to lower our cholesterol, not eliminate saturated fat and animal products. Although I do have a mostly plant-based diet, it's great for other reasons. We cannot tell you that it's going to improve your cholesterol because it just most likely isn't. We were wrong about that. Okay, well, I could go on, but I just want to stop here at 5 things that I personally got wrong. Probably the 5 most important, I think, and I'm going to review those because you don't want to get these wrong anymore. And if your doctor's still getting it wrong, you can bring it up and have a discussion. We were wrong about menopausal hormone therapy, number 1. Estrogen does not cause breast cancer or heart disease. In fact, it reduces death from both of those. Number 2, We were wrong about everything to do with metabolic function. Don't wait to be diabetic. We want to have optimal metabolic function, not just not be diabetic. Number 3, we were wrong about exercise. Don't be afraid to do a lot of exercise. Lift some weights, way more than 150 minutes a week. Find something you love, don't get injured, something you can be consistent with, and do it as much as you can. Number 4, we were wrong about antibiotics being harmless. They are so harmful. Now they're also life-saving, but inappropriate use of antibiotics, completely, we got that wrong. And number 5, we were so wrong about cholesterol, everything to do with cholesterol, what the measurements mean, how what we eat affects it, all of those things. So now you know more than most of your doctors. I want you to take care of yourself, be empowered. If you learned something today, please don't forget to subscribe, share it with your friends. Remember, we do see patients here in Houston in 2 locations as well as virtually. Check out our website address below, and we'd love to see you here as a patient. And I can't wait to see you next week.